well next time. So today our focus is on children's mental health, mental and behavioral health. And I'm going to let Annette open it up with our Strong Start video for today.
Thank you, Amanda. I think you will love today's Strong Start video like you do every day, but as Dr. Kelly said, this Isabella Santiago may put her out of a job. So our youth, Isabel, she's been interested in mental health and wellness, and she has been doing an amazing job researching it and finding ways to help students. We know that especially during the pandemic, things have been difficult for our children. And so as you watch Isabel's video, it has some powerful points in it and some visuals. So I know you'll enjoy it. She's been able to connect with a person in our community, Joyce Bozen, who does trauma recovery yoga. And it is focusing on helping children be resilient, using affirmations and helping them have some of the coping skills that we need. So Isabel's doing great work, and I hope you enjoy her video.
I'm Isabel Santiago. I'm part of the Strong Start Governor's Cabinet, and I'm the Director of Mental Health and Wellness. Mental health is something very important to me because it is a topic that is often not talked about or just ignored. But we should not ignore mental health because K-12 students are struggling with it now more than ever due to the pandemic. So here are 3 things I can do in my community to better improve mental health. 1. Bring awareness and reduce the stigma of mental health. 2. Provide mental health resources for K-12 students. 3. Educate K-12 students on how to better cope with mental health, such as talking to a trusted adult like a counselor, teacher, or parent. You can also start journaling. Journaling is a good way to express your emotions and feelings. I like to put on some relaxing music and color to my heart's content. We are the future, but we need to be seen, heard, and supported now. Thank you, and I hope I can count on your support.
So I appreciate Isabel bringing light to the subject and showing that it's okay not to be okay, and kind of helping people understand that it's all right to talk about it, and removing that stigma, and just the importance of everyone being seen and heard. So, and I love the sunflower on her shirt too. I caught that this time as I watched it back, and just that bright hope that she brings. So this is our future, and we are in good hands.
Perfect. Thank you so much, Annette. It's so nice to be able to open up the day with inspiring words from our youth. And we actually have one more video that I am going to pull up. That is from Kyler's Kicks. And that is a youth-led group, or I should say it's a youth-started organization. And so I am going to play that video for you now. So if you haven't had the opportunity to learn about that organization, I definitely encourage you to. I've had the opportunity to meet Kyler, and he's a very inspiring person, doing obviously great things in the community. And again, it's so great to see that what, you know, one person's passion can do for, you know, for our community. So all right, we are going to just give us a second, and we're going to bring up our schedule for today. We're going to walk over a couple of bills and then just provide again some of the tips on how you can participate in the session throughout the day. And then we'll have a brief break before we go into our morning panel on youth suicide prevention at 9 a.m. Okay, so hopefully you guys can see up on the screen, we have a couple of bills that are related to mental and behavioral health that we're going to review. Again, this is not a full list of all of the bills. We're trying to track as many bills as possible on our bill tracker, but we wanted to take an opportunity just to mention a few of these today to keep an eye on. And I'm calling in resources from from Char Frost from Nevada PEP, who also keeps a close eye on these bills as well. And I'm sure Danette will jump into whenever she has additional information. So again, these are a couple of the bills regarding mental and behavioral health. So for SB 56, this one is looking at continuing services for telehealth care. This was started at the beginning of the pandemic as an emergency service in order to be reimbursed from insurance. And so they're looking to make sure that that's continued and people can keep accessing services in that manner. The next one is SB 70, and this is looking at changing the rules around chemical restraints and people who are in institutionalized settings. And Shar, I know this has been one that we've discussed a bit. I don't know if you want to talk a little bit about that one.
So yeah, this one came out of the Northern Regional Behavioral Health Policy Board and makes changes to what we currently refer to as Legal 2000s and changing that moniker to mental health crisis hold. But also there was a bill last session that made some changes to the way we place mental health crisis holds on children. And so there's an attempt within this bill to help correct some of that, notifying parents not within 24 hours, but within 8 hours, things of that nature, because nobody wants to not know where their kid is for 24 hours. There are quite a few, this has already gone through its first hearing and work session. There were quite a few amendments that have not yet been published. So it's looking a little bit different. They had to change some things related to assistive outpatient treatment and the court-ordered pickup for adults, not for children. So this is primarily focuses on the adult side of the house, but there are some children pieces in there just to kind of clean it up and make it more child and family friendly.
Perfect. Thank you so much, Shar. The next bill, SB 116, this provides training on recognizing mental health issues in youth and also requires the Department of Education to set up a system of supports. It goes into a little bit more detail on that with the boards, but it's great to see that there are legislation making sure that we are increasing a focus on that, this especially given the pandemic. But you know, we also have to stay and have to remember that this has been an issue before, long before the pandemic, that we've needed increased support. So we're glad that it's highlighting it at this time, but we have a long way to go before we're fully supporting the mental health needs of our youth. The next bill, 156, revises requirements for a crisis stabilization center, and I don't have a lot of information on that one.
So this idea of crisis stabilization centers, this was passed last session during the 80th session. It was very limiting about who could actually become a crisis stabilization center. So this just broadens that, because we actually have not had one crisis, to my knowledge, not one has popped up. So this will allow different types of health facilities to become endorsed as a crisis stabilization center. Am I correct, Jeanette? Yes.
And hopefully this should help reduce the need for individuals to go to the ER or places where their specialty is not mental health, and not get the services they need and be stuck there waiting for places to go. So this should help them get treatment a little bit quicker by expanding those locations. All right, the last one to talk about, unless Char wants or Jeanette want to bring up any other bills for mental health. This one, SB 154, this is looking for the Department of Health and Human Services to apply for a waiver to receive federal funding for the coverage of substance abuse treatment and treatment of other mental health disorders when a person is or in an institution. So these are the bills. So I will just open it up for any other comment or information on other related bills that I didn't include.
So I just want to say on SB 154, I think this one is very important, because there seems to be this disconnect between mental health serving systems and substance use serving systems. And there's a lot of crossover between these two populations. This is one of those bills that looks like it doesn't do that much, but it actually will allow us to treat individuals with co-occurring disorders. So that's really exciting. The only other one I wanted to bring up is not yet a bill, but we know it's coming. And it's BDR 355, sponsored by Assemblywoman Michelle Gorlow, and the regional consortia are all very excited about this one, because this bill, when it finally comes out, will formalize the state consortium, which has been meeting for years and years, but it formalizes the state consortium into NRS, much as the regional consortia are, and gives them additional responsibilities, so that it's just a little bit tighter, and they're able to have that broader state view.
Perfect, thank you. Jeanette, did you have anything that you wanted to add?
I don't, Amanda, you have covered this beautifully. And I agree with Annette's chat remark about what a great job you've been doing highlighting different bills on the specific day. So really great job.
Thank you. I couldn't have done it without my partners assisting every day. It's been very helpful, given that I don't get to live in this world every day, even though I wish I could live in it more. Okay, we just also want to just show you, if you can scroll up one screen, some of the bills that will be heard today that are on children's issues. And, you know, just a reminder for some of you who may not, again, do this on the daily, that bills are being added to committees ongoing. So we even had to update this morning from last night, because there were different bills added. So while this may be true right now, it certainly could look a little different as the day goes through. So I encourage everybody to sign up for the bill tracker on Nellis. If you have a state state email address. You can track as many bills as you want for free. And if you don't, you can track up to 10, which for most people, that's fine and it suffices, but it will email you anytime that there's a change on one of the bills that you're tracking, and whenever there's movement on that bill. And I know it's a great service and it's been very, very helpful, and it's very easy to sign up on the NELA system. So this is just a list. I'm not going to go over all of these bills that are here, but you can see that this is a little bit of what's going on today. They have the areas they cross all over, you know, what we're covering this week, having to do with education, children's safety, child support, the education bill that was brought up this morning by Senator Dundara Loop. So we have a variety of topics today, and we'll have, after our 9 a.m. session, we'll have that gap between that and 3:30, where we're hoping that you can go on and watch some of these hearings. And as she mentioned, maybe to be brave enough to provide some public comments, so that way the legislators can understand the perceptions of the public. It is so important, as a lot of people don't get involved in the session. Your opinion can really weigh a lot. And if you do not want to do that verbally or during those sessions, then you can also do it electronically through the Share Your Opinion, which we'll go over in just a minute. But I just wanted to pause to see if anybody wanted to highlight or mention anything about any of the bills that will be heard today. And I know there's one on there for Pritzker later today.
Yeah, Amanda, I just wanted to mention that. I have to look and see here who is on from CAA, but the AB 189 is the bill that would allow for presumptive eligibility for pregnant women under Medicaid. So very important bill, and Dr. Kelly Baumgartner will be part of the presentation team for that bill. Also, just as a advance for tomorrow, Assemblywoman Gorlow, whose bill that is, will be joining us tomorrow for coffee chat. So, and I know we just had a meeting with her on Monday to go over, you know, what the presentation would look like. And she always says, I get positively giddy when this topic comes up. And at one of our meetings a few months ago, she mentioned that presumptive eligibility for pregnant women was actually the reason that she decided to run for the legislature, because she wanted to impact change in that area. So she's finally getting the opportunity, and it's a big day for her as well.
Perfect, thank you. Before we move on, does anybody have any questions or want to provide any comments? Okay.
So Amanda, it's Jane Saint from Nevada Casa. This has been really great. You know, while I wish we were all together, by doing it virtually, I feel so much more engaged in the process, because I don't have, you know, people pulling me away, coming to the table and wanting to talk or networking. And so thank you so much for putting this together. It's most informative. And next session, I think we need to figure out how to incorporate both in person and virtual. So great job. Great job.
Absolutely. Thank you. And I couldn't have done it without all of you and being partners, especially with our partnership with the Children's Advocacy Alliance, that this wouldn't, you know, this week really came together as efforts between a whole team of individuals and organizations like yourself, who I know have participated for years, jumping on board with us, trying it in this new format. So we're very happy that we're able to have some type of, like, again, presence here. All right, Amaris, if you want, go ahead.
I really appreciate not having to travel and stay in a hotel room that has a really wimpy shower head, because I'm at home and I got my own shower head.
Is it sad that I missed that?
I didn't have to pack anything.
Well, and I miss the occasional burst of very cold water in the middle of a shower. That was when the pressure seemed to get really strong.
Yes, I am missing Carson City is a beautiful place though, and I am sad I don't get to go up often. And if any of you on the call or on the meeting haven't had the chance to go up to Carson City yet, I highly recommend that you visit it. It's a beautiful. At least the main street is where the legislative. I'm sure the rest of the city's fine too. That's been my main where I'm most familiar with. But it's a wonderful little city. Okay, so now we're just going to go over some of the tips for how to participate in the day. And Jeanette, I don't know if you want to talk about some of those, as you've been so kind to.
Absolutely, would love to. And I'd like to kick this off reflecting back on what Senator Dondero Loop said. They are thirsting to hear from you, you know, and that would be in a virtual world or an in-person world. As she mentioned, because the legislature is all virtual now, they are basically in their offices and have a lot of accessibility really to email and other ways that input is put into the legislature at this time. So please, please, please think about the bills that you want to support. It's not terribly intimidating to be part of the process. And I agree wholeheartedly that hopefully not only Children's Week, but the legislature, other public open meeting law meetings will continue to keep a virtual component so that access can be increased. I think the participation rate has been phenomenal, and folks who may not normally have the time to be able to go to Grant Sawyer or up to Carson City to testify can do that from the luxury of their own living room. So pretty exciting benefit from this really strange and stressful time. So just some brief advocacy reminders. They do want to hear from you, but they also appreciate when you're brief because, you know, we are all very, very passionate and we could go on and on and on about whatever we want legislators to know. But it's important to think ahead of time about the 2 or 3 things that you want to make sure that when you leave that person, whether it's virtually or in a statement or what are the 2 or 3 most important things that you want to leave them with. And if you approach your remarks from that perspective, you will be a lot more focused and will give them the opportunity to go through your information in a more succinct way and then be able to go on to the next person. One of the things I like to tell folks is that if you do have a story, those are very impactful. And, you know, I think back to the videos that we've been seeing from Annette has been showing every day. These kids are doing exactly what we hope to do, is to explain your story in a way. I don't know, Isabel this morning said, and there's 3 ways, and then she listed them, 1, 2, 3. These are great tips from young people on how to get your message across. Also, if you have a story about something, you know, a real life family, you don't need to identify anyone. But stories often stick more than any long-winded, you know, presentation about numbers and so forth. Numbers are important and they certainly do have their place. But when you want to make a point, often a story about a child can make a difference, and certainly something that they can move forward. And retain, because they're getting a lot of information every day. We strongly encourage you to meet with your legislator. I know that we are not here all in Carson City together, and there would be more efforts to schedule meetings with legislators with groups of people. There's absolutely nothing that prevents you from doing that with your own legislator. They love, love, love to hear from constituents. These are the folks that are in their districts where they live, and have an opportunity to connect and understand what's important to their constituents is very, very important to them. Don't be embarrassed if you don't know who your legislator is. That is not something that everybody necessarily knows, but we do have an easy way on the legislative website to be able to identify your legislator, and that is through your address, your home address, and your zip code. And Amanda, if you don't mind putting that link into the chat box, that will is an easy way. You just put it in, it brings you to a map. You just put in your information and it'll bring you right to the names of your legislators. So your Nevada Assembly person, your Nevada Senator, as well as a couple of other folks that represent you. There are also lists on the legislative website of senators and assembly persons, and those have the names of their name, the district that they represent, and also the email address that you can reach them at, as well as phone numbers. There's a number of ways that you can reach out to them. And they really, really, really want to hear from you. Bills, as we've talked about, are heard in committee. Amanda went over this morning all the bills that are going to be heard in committee today. If you have strong feelings about a bill, for, against, neutral, if you want to put more information on the table, sending an email to all the members of the committee is also another way to impart information on them about what your feelings are about the bill and what's important to you about that bill. I would strongly suggest when you do that, that you put the bill number in the subject line because they're getting emails from all different, places, and a little short description of what that bill might be. So for example, AB 123 relates to the summer school bill, as Senator Dondero Luke mentioned. And you might also think about adding in support of AB 123 summer school bill. That way they know what the position is that you're trying to impart. If you are interested in maybe some changes to the bill that would make it more comprehensive, you might write something like proposed changes to AB 123. So think about what you want to put in the subject line, because that will help you to for the legislator to understand a little bit more about what you're actually trying to say. And then put the rest of the information in the body of the email. We have the legislative website listed here, www.leg.state.nv.us. It is truly a wealth of information on an amazing amount of information that's out there. And so if you're curious about a bill, a particular bill, you can look that bill up. It will give you the current status of the bill, whether it's had a hearing or not, if it's had a vote, what the vote was in the Senate or the Assembly, broken down by the legislator. So you can see, if it was a bill that was supported by all senators, it would be a 21-0 bill. If there were some yes votes and some no votes, it'll break that down for you, and you'll know which legislator was on each side of the bill in terms of the vote. I am going to take a moment here to pull up an infographic that my team prepared on how to participate in the legislative process. So if you just give me a moment. Just confirming, Amanda, that it's up. Yes, thank you. So this is how to virtually participate in the legislative session. First, most important is go to the legislative website, and towards the very top right-hand corner is a little section that talks about scheduled meetings. Those are not only the meetings that are scheduled for today, but if you keep scrolling down that list, it's everything that's been scheduled up till now for the legislative process. So we don't always get a lot of notice, but you'll see 2 to 3 days in advance that there are already meetings that have been scheduled around bills. When you click on that scheduled meetings, there are a series of, obviously there's lots of committees that are hearing bills. And we've just picked one out here, the Assembly Committee on Health and Human Services. They are hearing AB 181 in this example at 1:30, and that is on the day that you picked. So for example, today. Underneath this 1:30 on the day of the hearing, so if you look 2 or 3 days in advance, you won't see this, but on the day of the hearing, there'll be a couple of links down here for you to be able to access that hearing, either through the state legislative website or through their YouTube channel. And we'll be going over the YouTube channel in a moment. And if you just click on those, that's going to bring you to that meeting. If it hasn't convened yet, so if you've tuned in a little early, it'll just say that they haven't convened, and then you can go get an extra cup of coffee and sit down with and wait for them to start. I must say that in the virtual world, one of the little silver linings in the pandemic is that meetings are starting very on time. We used to wait and hearings would run over. The next one wouldn't be on schedule. It's kind of like Southwest when they get behind, you're behind for the whole day. And now, because of the complexities of having to do the online virtual transmit or stream of the hearings and the broadcast booth staff, they are very on time. And it's exciting that you don't have to sit in a really hard chair in the one of the hearing rooms and wait for your bill to be heard. So once you've chosen the bill that you want to look for, the committee, you will see a little option for additional meeting details, and you'll see that there are a couple of options to participate. We'll be going over both of these. So it's either you can submit an opinion or you can participate. This particular hearing is on March the 1st, and it's online at 3:30. If you want to submit an opinion about the bill, you click that submit opinion highlight that we've highlighted there for you, and it'll bring you to this screen. This select a bill is actually a drop-down box, so it's customized to each of the hearings that are available on that day, and you can click from the drop down over here the bill that you want to submit your opinion about. Or you can type in the bill information and get that get bill information about it. So for example, AB 123, you don't want to put a space in between it. It's just AB 123 or SB 123 is appropriate. And then you'll indicate whether you're in favor or against the bill. And then you can have up to, my understanding is 2,000 characters below to actually submit your comments about the bill. And if you want, you can, just describe a little bit more here about why you're support or opposed. I think it's helpful to do that because legislators want to know kind of what's behind your opinion, especially in opposition. Would you like to see it changed in some way? Would that make it more palatable? So a little bit more detail there, I think, would be great. been very helpful. Notice that it will ask you for some personal information to determine what legislative district you're in. That, per the very top of that page, is not shared or made public. And once you fill out that information, you're done. The reason they want to know the legislative district you live in is because that will also be submitted to your legislator, so they understand what people in their district feel about a particular bill. To submit public comment, so going back up here, rather than just submitting something in writing, if you actually want to participate and provide public comment, so verbal comment, you select the participate button, and it'll take you to a meeting participation page where, again, you'll fill in some basic information. You will select whether you wish to comment on a specific agenda item over here, or general public comment. Excuse me. You can make comment on more than one bill. So if, for example, like today, it's there's several bills on the health agenda this afternoon that you may be interested in. You can choose more than one. The drop-down box, again, is here for your position and who you're representing. That's important. And that you check this little box here if you want to speak on that item, and then add this item to your list. They want to make sure that you're a person and not a robot, so you need to check this little box here to be able to submit that. And then once that's all done, and you've opted to speak by checking that box, it will show that you've been successful, and then we'll provide you with call-in information to be able to connect to that meeting at the appropriate time. You can give testimony at that point by phone. So that is the option where we used to, go to the table to give a testimony. This is done by phone. You are actually not on screen. At that point, it just says that it's audio only, so they'll only be hearing your voice. All testimony is limited to as little as 2 minutes, although yesterday I was in a hearing where they allowed 3 minutes. 2 minutes is the low end. So you want to make sure that if that's the choice of the chairman that day, that you can fit it into 2 minutes, because they will cut you off and tell you to please wrap it up. So if there's something important towards the end of your testimony, you may not have the opportunity to deliver that verbally. So we find it helpful to prepare your remarks ahead of time. That way you can practice and make sure that it fits into a 2-minute time frame. Remember that part of your 2 minutes is an introduction. Good morning, Madam Chair. My name is Jeanette Belts. And then you have to spell your name for the record so that the folks that are doing the minutes later can transcribe that correctly. So, and that's all part of your 2 minutes. So think about that when you put your thoughts together. You can either write it out and read it, or just do something like bullet points if you're comfortable speaking that way. Just some bullet points of things you want to make sure that you highlight. And then you'll have the opportunity to speak, hopefully. Just to let you know, they do sometimes limit testimony in favor, in opposition, and neutral to 20 minutes in total. So if you're giving 2 minutes, that gives 10 people an opportunity to speak. And if you're the 11th one, you're not going to be able to do that. But hopefully you will have the option to be able to speak. If for some reason they do run out of time, you can always go back to one of the other options and submit written testimony or your opinion about the bill. A quick little tip here is they will identify you when it's your turn to give that testimony. by the last 3 digits of your phone number. So just make sure you have those in your head. And then you will be given instructions on how to unmute yourself and participate. Remember to unmute your phone as well. You may have unmuted your phone personally or muted it, excuse me, to cut down on background noise. Remember to unmute your phone and then also follow the instructions on how to unmute yourself for the purposes of their system so that they can hear you. You can also submit written testimony, and for that, check the agenda. So every agenda for every hearing, every bill has a paragraph towards the bottom of the agenda that talks about how to submit written comments. Each committee has a separate email address. I'm circling the one here for Senate Education. And that is the committee personnel for that particular committee. Same thing as we talked about submitting comments to the committee as a whole. It's helpful to put the bill number in the subject line. I like to put in who the written comment is being submitted on behalf of. So for example, Children's Advocacy Alliance. And then I also like to include, for example, that it's a letter of support. So just giving more clarity to the people on the other end who will be receiving this so they can make sure to post it in the correct section of the bill exhibit page for each of the bills. I'm going to put this handout into the chat, and if any of you have any questions about it, we're happy to address those. So you can always put your questions in chat. Someone is probably watching those. I'm not terribly good at it while I speak. But another way to get information to legislators is to use social media. We're very strong social media users. The hashtag for the Nevada Legislature is hashtag NVLEG. That is monitored by not only legislators, by their staff, by agencies within the executive branch. So for example, the Department of Health and Human Services. We also will tag, for example, legislators who proposed a bill or sponsored a bill for us. So for example, Michelle Gorlow's bill, we would tag her as part of that. Then for Children's Health Week, very exciting, there's a hashtag specific to Children's Health Week, CWNV 2021. So you can just click on that hashtag in Twitter and then find all the posts that others have used. And you can retweet those or, add your own perspective to a particular bill. Also helpful to see if legislators are responding or further disseminating your views on a particular bill. So don't discount social media. It is widely used, not all legislators, but a whole host of them are very active on social media. And I'll turn it over to you, Amanda, to talk a little bit about your web address, please.
Sure. So we have a page dedicated for Children's Week, and this just provides the information and the schedule for each day, as well as the Zoom links. And then we are also adding, we have a resource section on that page. So there's a link to the YouTube channel where we showed the videos this morning, and we are continuing to update different testimony that we get submitted. We'll be showing some videos throughout the day. We also have a video that we'll be showing in a little bit from the American Academy of Pediatrics, or the Nevada chapter. Sorry, Leanne. So we're excited for you guys to be able to access those all throughout the week. Oh, thank you, Amaris, for pulling it up. Including that wonderful graphic that Jeanette made. We have that in the resource section as well. So you can feel free to go here if you ever need any of that information. And we will also be, so we're recording these sessions, so that way if people miss them, or they'll have a chance to go back and watch some of the panels, those will be updated. The files are quite large and we have to edit them down. And so those will be updated probably within the next week after Children's Week occurs. So. Perfect. So now we have about, we've got about 15 minutes before we start our next panel. We'll be talking this morning at 9 a.m. about youth suicide prevention. And we have our very own Dr. Amaris Knight from the Nevada Institute for Children will be talking about youth suicide prevention and some of the critical efforts that are happening in our community. And we also have Misty Von Allen, who's joining us from the Office of Suicide Prevention. So we'll have a discussion there where we welcome active participation from the audience, and then we'll have a bit of a break. And then this afternoon, Nevada PEP and Youth Move are actually going to be holding a panel to talk specifically about youth mental health and the broader perspective. And they will also be joined by a member of NAMI of Southern Nevada in that conversation. So we're hope that you'll be able to join us. And in between, we are always available in this room. We have different organizations you can see on the left that will be available to answer questions as we pop in and out. We know that it's been a little bit slow in the in-between. So oftentimes people, just hang out with the session going on in the background. But as people come in, we do make sure to provide information. So I want to pause to see if anybody has any questions. And then, like I said, I'm going to play the video from the Nevada chapter of American Academy of Pediatrics, but then we will just take a little break until we resume at 9 a.m. Does anyone have any questions?
Amanda,
Sure.
Not a question, but I inadvertently said I would talk about the YouTube channel and then jumped right over it. So if you don't mind, I'm just going to screen share really quickly about the YouTube channel, if that's okay.
Yeah, absolutely.
Okay, thank you. Whoops, my share button just went away. There we go. So I bring this up for a couple of reasons. The YouTube channel, Nevada State Legislature. So you can see here all of the hearings. You can access all of them right here, for example, for today. And what's exciting about this is not only can you listen to it live, so this is actually going on right now, but if for some reason you missed one or you want to go back because you heard about a bill and didn't know about it, you can find the hearing that it was heard at and then go back and listen to it. We do that sometimes just to clarify and make sure we got all the details about what someone said, particularly, someone say from the executive branch when they're explaining a rollout of a program or something. And this is really, really helpful to be able to go back and look as well. So thank you for the opportunity to share that.
Absolutely.
Hey, Jeanette.
Yes.
On the YouTubes, to go back and watch them, when you do a search, how detailed or undetailed can you get?
Yeah, the important part is that you need to know the committee. So what you would do, if you know the bill, right, which I'm assuming you would start with the bill, then go to the legislative website, go find that bill, and then look at the committee hearing that you want to. So for example, if it was yesterday, March 9th, it will tell you which committee it was heard in, and then you need to go to the YouTube to find that day and that committee.
Okay.
So it's pretty simple. There are other ways to get archived that are a little more complicated. This is actually simplified things with the video. And the nice part too is if for some reason you're watching it live and you get a phone call or something, you can put it on pause and then catch up. So you know, there are a lot of advantages to having the YouTube. The governor gives his addresses on YouTube as well. So if you know that the governor's going to be speaking out about something, he has a YouTube channel as well.
Great.
Perfect. Does anybody else have any other questions? Okay, so as I mentioned, we're going to show a brief video, and then we will take a few minutes break before we start our 9 a.m. panel.